Welcome back to the channel. As we wrap up Acne Awareness Month, we need to talk about one frustrating condition, and this is one that sometimes makes me want to pull my hair out of my head. Adult female acne. These are often women in their 30s, 40s, or perimenopausal years who may not have struggled with acne as teenagers at all, and suddenly they are dealing with persistent breakouts, deeper lesions, congestion, and inflammation, often along the jawline, chin, and lower face. The immediate assumption is usually that it must be hormones, and yes, hormones can play a significant role, but saying it's hormonal does not give us a clinical pathway to help the client. It does not tell us what to do for the skin at all. So today we are going to connect the dots between hormonal fluctuations, androgen activity, sebum composition, barrier function, and inflammation. Because adult acne is rarely just one thing, it's usually a full system response. Let's start with the androgen effect. The sebaceous glands are androgen sensitive. That means that they respond to androgen hormones such as testosterone and DHT. When androgen activity increases, whether cyclically before menstruation, through conditions such as PMOC, or during menopause, or even because of broader hormonal fluctuations, the sebaceous glands can become more active. Now, this in turn leads to increased sebum production, and clinically, this often shows up in the lower face. We may see breakouts along the jawline, the chin, and the neck area, but here is the important point. It's not only the amount of sebum that matters, it's the quality and the composition of that sebum that also changes, and that is where the barrier connection becomes much more important. When clients say that I think that this is hormonal, they may be right, but from a skin treatment perspective, that is only the starting point. As estheticians, we are not treating the internal endocrine system. That belongs to the appropriate medical professional, but we can assess how the skin is responding to those internal changes. We can look at the follicular environment, we can look at the barrier, we can look at inflammation, and we can support the skin in a way that reduces that downstream effect of those hormonal fluctuations. So rather than stopping at it's hormonal, we really need to ask, what is happening inside the follicle? What is happening to the sebum? And how is the barrier responding to it? Now, this is where the altered sebum composition matters. Healthy sebum should flow and it should help lubricate the skin and support the surface environment. But under androgenic influences, sebum can become thicker, stickier, and more stagnant, and the lipid profile may shift. We often talk about a reduction in essential fatty acids, especially linoleic acid, and an increase in components such as squalene. When sebum becomes thicker and less fluid, it does not move easily out of that follicle and it begins to accumulate. The follicle becomes more congested, the oxygen level inside the follicle decreases, and that low oxygen environment can favor imbalances with Cutibacterium acnes. Now, at the same time, oxidized sebum can become inflammatory. This is no longer just too much oil. It is altered oil, it is stagnant oil, and oxidized oil. And that altered follicular environment becomes a trigger for congestion, inflammation, and recurring adult acne. Now let's connect this back to the skin barrier. The skin barrier depends on a precise lipid environment. The stratum corneum needs ceramides, cholesterol, and free fatty acids to maintain structure and function. When essential fatty acids are deficient, the skin lipid matrix becomes weaker, and that means that the barrier becomes less effective at holding in water. Transepidermal water loss therefore increases and the skin becomes dehydrated even when it looks oily. And this is one of the biggest clinical contradictions in adult acne. The skin can be oily and dehydrated at the same time. The client sees the oil and thinks they need drying products, but underneath, the skin barrier may already be water depleted and inflamed. This is the barrier connection. Essential fatty acid deficiency weakens the skin lipid barrier, and when that barrier is weak, transepidermal water loss increases. More water escapes from the skin and the surface becomes dehydrated. That dehydration affects the enzymes that is responsible for natural desquamation. The skin cannot shed as efficiently. Dead or cornified cells accumulate. They become sticky, they sit over the follicle, and now we have the perfect storm. We have thick, altered sebum trapped beneath that dead cell that cannot shed properly, inside a follicle that is already more inflamed and more reactive. And this is why adult acne becomes persistent. It is not just a spot that needs to be dried out. It is a barrier, sebum, and inflammation cycle. This is why aggressive acne treatment so often backfires in adult acne clients. If the skin is already lipid deficient, dehydrated, and inflamed, then stripping it further does not solve the problem. It can make the barrier weaker and can increase transepidermal water loss. It can make desquamation worse, and it can leave the client with skin that is simultaneously oilier, tighter, more reactive, and still breaking out. This is the client who says, my skin is oily, but it feels tight. My acne products make me peel, but I am still congested. My skin looks shiny, but it feels so dry. This is the sign that we need to stop chasing the breakout and start supporting the skin structure. So clinically, how do we support this? We cannot change the client's hormones in the treatment room, but we can change the follicular environment. That is key. We can reduce inflammatory triggers, we can support barrier repair, we can choose non-stripping agents, and we can consider hormones, lifestyle, and referral when needed. This means that we need to avoid over-cleansing and over-exfoliation and constantly drying the skin. We need to support the barrier with appropriate lipids and hydration and gentle routine designs. We can consider ingredients and formulation that supports a healthier follicular environment, including essential fatty acid supports without overwhelming the skin. And we need to recognize when the acne is persistent, severe, scarring, or strongly hormonally patterned, because that is when medical referral may be part of responsible care for our clients. Adult acne improves when treatment protocols supports the skin function, not just symptom suppression. Treating adult acne requires looking at the full picture. It's not just hormones, it's not just oil, it is not just bacteria. It is an interaction between androgen activity, sebum composition, follicular environment, barrier integrity, TEWL, desquamation, and inflammation. So when we understand that, then we stop treating adult acne as something to attack. We start treating it as a skin function problem that needs strategic support, and that is where clinical reasoning becomes absolutely essential. Inside my professional skin assessment mastery course, this is exactly the level of thinking that we develop, and we look beyond that visible breakout. We assess the skin structure, function, and barrier condition. If you want to learn more, there's a link in the comments below. Okay, you guys, thank you so much for watching. Please like, subscribe, and share with a practitioner who wants to understand adult acne beyond its phrase, hormonal acne. It really makes a difference to support this channel, and I will see you again next week.